Coming up, we'll be on location at Loebig Wellness and Chiropractic in Great Falls, Virginia, discussing the latest advances in chiropractic health and wellness with effective treatments for neck pain, back pain, sports injuries, neuropathy, and more. With one of this area's top wellness and chiropractic experts, Dr. Glenn Loebig. Welcome, Dr. Glenn, to the Top Doctors Interviews program.
Thank you. Thanks for having me.
All right, it's our pleasure. We've got a lot to talk about today. You're helping so many patients in the community improve their health, their wellness, treating pain, injuries, all different types of modalities that you offer here that are very effective. But before we get into that, I wanted to touch on your background. You're recognized as one of this region's top chiropractic health and wellness experts throughout the Northern Virginia region. And I wanted to ask you about your vision for your practice.
Well, the vision we have for our practice is every patient that enters through our door, we're able to help them achieve their health goals. And for every individual, it's going to be unique, just as their conditions are. For instance, we've had patients that couldn't go on vacations any longer with their spouse. So they were concerned that their spouse would lose interest. They couldn't go and tour different areas of the country, go on beach vacations and walk the beach. Then we'll have people that want to get back in the game. They're an athlete. They need to get back in. They're injured. They need to recover from their injuries and get back on the field. We have active dads. They want to be active with their children. We have grandparents. That often goes with our neuropathy program, where people have difficulties from neuropathy ambulating and walking. And we're able to get those people back to their health, and that's very rewarding for us. So our vision is to find out what their health goals are and do everything that we can to help them achieve those goals.
That's a wonderful approach, Dr. Glenn. You not only help patients get their lives back, but it improves their mood. The pain can be debilitating, whether it's related to their job or, like you said, vacations, just family life. There's so many aspects of our life that are impacted when we're dealing with these issues. So you're really helping people get their lives back and really enjoy life again.
Yeah, exactly. Just recently we had somebody come in, and unbelievably, they had difficulties even walking in the door. They were turned away at the emergency room, told that they were okay, that the imaging was okay, yet she could barely ambulate and was in excruciating pain. We actually even came in as an emergency on the weekend to treat her. And happily, within a couple weeks, she's ambulating just fine. She's now driving again. She was unable to drive. So when we can help people with those kind of disc injuries with our non-surgical spinal decompression program, it's very, very rewarding, because other places have failed. You know, they do the best they can. They're trying to help the patient, but unfortunately it hasn't worked out for the patient, and they have nowhere else to turn oftentimes when they see us. And we do the decompression. We have 3 national certifications in decompression therapy. I like to say we specialize in that, and we help people with injured discs, sciatica, all those types of pains that can really be debilitating.
Well, that really speaks to your patient-centric approach. I mean, to be turned away when you're in, that kind of condition is pretty scary. But you guys were able to take that patient and give them the time that they needed to really help them. And that, again, speaks to your really great patient care that you offer. And by the way, we spoke to some of your patients, and they are full of praise. They love you guys.
Well, thank you very much. We love our patients, so we love to do everything we possibly can to try and get them to where they want to be.
Now, there's been a lot of advances in chiropractic, health and wellness treatments. What are some of the key treatments that are most effective here at your practice?
Well, naturally, we do a variety of different chiropractic techniques. So like I like to tell a patient, your medical doctor is going to give an infant the same dose of a medicine they give a healthy adult male. So we temper our chiropractic treatments that way also. But what we've really started to specialize in is some non-surgical spinal decompression to help with disc herniations. We have over a 90% success rate in keeping people from surgery with those. We also have a neuropathy program that's quite effective. Oftentimes, unfortunately, they're told that there's no alternative for them, that there is no treatment for neuropathy. And we've found that not to be true. We have FDA cleared instruments that we help, technologies that help us achieve and get people past their neuropathy pain and back to functioning. So we had another patient recently. She came in. I thought she was going skiing. She came in with some ski poles, and she's walking with ski poles because of her balance was so bad. And in a couple weeks, we were thankfully able to get her off the ski pole. She's ambulating normally. Now she's not ready to run a marathon, but she's improved dramatically. She's quite happy.
Speaking of neuropathy, Dr. Glenn, we do hear that phrase a lot, and people don't really know what it is. Could you tell us what neuropathy is?
Yeah, neuropathy is symptoms coming from your peripheral nervous system. So what does that mean? That means the nerves that go to your hands and your feet. And oftentimes it'll start in the feet, and then if it gets severe enough, it can progress to where they get symptoms in their hands. Now, that can feel like tingling, burning, itching. It can feel like a balled up sock underneath your foot. So all these symptoms are typical of a neuropathy patient. So there are a myriad of different causes for that. You can have compression from your spine, which I mentioned decompression therapy is very effective with that. There's diabetic neuropathy. There's idiopathic neuropathy. Nobody knows why somebody's suffering from it, yet they have nerve pain. And they've been to neurologists, they've been to surgeons, nobody's able to diagnose the neuropathy. It's idiopathic, nobody knows. There's chemo-induced neuropathies. So there's autoimmune neuropathies. There's a lot of different categories. However, most of them have very similar pathologies in how we approach it and what we can do to help the patient.
And what would you say are some of the most effective treatments available to treat neuropathy?
Well, I mentioned if it's compressive neuropathy, we have phenomenal success with our non-surgical decompression. And I want to mention that because there are a lot of people that mention that they do decompression therapy. However, there's only 2 tables that really have research on it. So it's just like a surgeon with doing robotic surgery. They may have the instruments, they have to know how to properly use that. We have 3 national certifications in non-surgical spinal decompression therapies. So that's something that people have to be aware of if they are searching for decompression therapy. So that's good for compressive neuropathies. Now, as far as diabetic neuropathies, there are some technologies that help increase the circulation. Diabetics often are in fear, or they hear of, losing limbs. And that is very common whenever somebody gets a lesion on their foot and it doesn't heal, it can get gangrenous and they lose a limb. So we have to increase the microcirculation to the nerves in their feet, and we have technologies that can do that. Then you have to start working with the nerve. We have different technologies that help start to re-educate the nerve to get it functioning optimally. So the beauty of it is some of these treatments they're able to do in their home. Some of them they have to come into the office for. But we tailor the program based on the patient's needs and conditions.
And when can patients begin seeing results from these treatments? Is it right after the treatment, or is it after several treatments?
Well, it depends on the type of modality being utilized. So sometimes we'll have patients that come in extreme pain, that we do some chiropractic manipulative therapy, and it's miraculous. They get up, they walk out, they feel much better. And sometimes the symptoms will return and sometimes they don't. And that varies by the condition. But some of the most dramatic results are with the chiropractic manipulative therapy. Now, when you get into more serious disease states where, sometimes we treat people in wheelchairs, well, that's going to take a lot of work and time. And if the patient's patient and does their due diligence at home, we're able to see that patient progress. Now, I mentioned a lady with the ski poles who she was having trouble with balance. We were able within a couple weeks to get her off of those. Now, sometimes that may take a couple months. But if the patient is willing to be diligent, do their homework, and come in here and see and do their appointments on time, we're able to achieve those results if they follow our program.
That is very impressive, and your expertise, your experience in neuropathy, it really sets you apart from many other practices in the region, and that's why you're having so much success. Are the results permanent? Is it something that can be cured, or is it a treatment that has to continue for the rest of our lives?
So it depends on the genesis of the neuropathy. So as we were talking about previously, if it's compressive, in other words, coming from their spine, oftentimes they can recover, and then with doing some rehabilitative exercises, they're good to go for months to years. And then if they start to have some problems again, they'll consult us, and hopefully we catch it early enough they don't need the decompression again. We can do manipulative therapy or do some other types of soft tissue treatments that help get them over that little emergency. Now, if you're talking about diabetic neuropathy or some kind of drug-induced neuropathy, then we're talking about some problems that could be ongoing. Why? Because diabetes is a degenerative disease in and of itself. So when there's a cure for diabetes, then it will be a cure for their diabetic neuropathy. So that once we get them optimal with their neuropathy under diabetes, they do have to maintain a lot of that maintenance, but as we discussed earlier, some of that is done in the comfort of their home.
So that makes sense because it really depends on the root cause of the neuropathy issue that they're experiencing. So if you're able to treat that root cause, then you can, take care of the neuropathy as well for the long term, right?
Exactly, and that's one of the puzzles when people come in. They're very aware that they have neuropathy, and if they're diabetic, they're very aware that it's diabetes. But they're also shocked whenever we do further investigation. We find out they have an overlapping compressive neuropathy that could be complicating it. So if you just do the treatment for the metabolic part, which is the diabetes, and you don't address the compressive, they're going to improve, but they're going to hit a plateau that they can't get past until you address the compressive component also.
Now, is neuropathy something that occurs at certain ages, or could it affect children or pretty much anyone?
I haven't seen it in children and even in young adults. Now, if it is happening there, that's going to be a compressive neuropathy typically. If they have type 1 diabetes and they've had it since they were a teenager, there's a chance that it's diabetic. But mostly you're looking at an older person's type of disease. And so in that, there's a lot of degenerative diseases that go along with aging.
That's great to know, Dr. Glenn. That can really help so many people that are experiencing their neuropathy and all the associated symptoms and pain and suffering that they go through. You also offer decompression therapy that's non-surgical. Can you tell us a little bit more about that?
Yes, most people are not aware that the origins of non-surgical spinal decompression therapy trace back to an actual neurosurgeon from Canada. He had some concerns with discs in his back. Anyway, he evolved and developed non-surgical spinal decompression. That was the genesis of it. And the beauty of that table is it's so sophisticated. Oftentimes, people that are unaware or uneducated on it believe it's traction. It is not traction. The mechanism of the non-surgical decompression is different than traction, so that there is no muscular contracture whenever we're decompressing the disc. So we can actually take pressure off that disc and nerve during that visit. And it's cumulative. As we do a series of these, the body gets a chance to heal. And that disc herniation can heal to a point where it's non-surgical any longer. And then we can get those people into rehab and get them strengthened in their back to activities. So there's a lot of different things that happen whenever you're doing non-surgical spinal decompression. And that comes into qualifications, and we have 3 national certifications in non-surgical spinal decompression therapy.
And what are some of the main health concerns or issues that non-surgical decompression can address?
Well, there's degenerative disc disease, where the disc is getting thinner and thinner. That compromises the nerve root opening and often leads to stenosis. So it can help with that. The other conditions it helps with, obviously, are disc herniations. And we've had disc herniations on follow-up MRIs completely resolve and look close to normal. Now, the other thing it helps with, and a lot of people are very scared after having this, and I understand this, is certain back surgeries, and they're looking at possibly another back surgery. Now, if they have hardware, if they've been fused, they are not a candidate for non-surgical spinal decompression. However, If they've had what's called a laminectomy or a microdiscectomy, they're an excellent candidate, and they do very well with non-surgical spinal decompression.
And Dr. Glenn, like how would someone know if they're experiencing a herniated disc? What are some of the common symptoms that people should look for?
If it's an acute condition, in other words, it's very recent, they're going to be in extreme back pain. Oftentimes they've come in and they've gotten some medicine from their medical doctor, often an oral steroid pack to try and decrease the swelling. They've gotten some muscle relaxers, and it's not quite getting them the relief that they're looking for. So they're in excruciating pain oftentimes whenever they come in. I had a young man that was in college that came in. He was in so much pain when he came in, he had to give me his history on all fours on a table, and he had a huge herniation at L5. So that's how you will know with an acute condition. Now, sometimes there's chronic back pain. It just won't go away. It's constantly bothering them. And they get these flare-ups. It hurts all the time. Then they get these incapacitating flare-ups. Then it calms down. Then it flares up. It never goes all the way away. And when you MRI those individuals, they're going to have some degenerative changes, but they're also going to have evidence of disc herniation. And that's what's getting aggravated when they have the incapacitating episodes. So when you can get them on a decompression table and you get that disc rehydrated and you get it healthier, they don't have those episodes any longer.
And do they start realizing the benefits of that treatment right after the first treatment, or when do they see results?
Usually not after one, because it is a very subtle. You can't take a really compromised area and do an extremely aggressive treatment. So these are subtle treatments that are cumulative, and it's meant to be that way. Oftentimes the patient, I almost guarantee you, they're going to say, "Oh, I don't feel anything. Can you turn up the intensity?" And I tell them that's beautiful, because if you're feeling anything when you're doing decompression therapy, you're feeling the muscle contract and stop the therapy. So that's the difference between non-surgical spinal decompression and traction. So if somebody thinks they're doing non-surgical decompression and they're feeling it, they're doing traction. They're not on a real decompression machine.
What I love about your approach is that it's non-surgical, which means there's very little to no risk, because surgeries always have risks associated. And we hear about all these stories where people get a surgery and they feel even worse, and then they go back and get another surgery. That should always be the last resort. So this looks like a great option for so many patients.
Yeah, I agree. And that's exactly how we coach our patients. Look, we're going to do everything we can to avoid surgery. But that's when you have surgery, whenever all else has failed. Then you have no other option. And I agree. At that point, you need surgical intervention. But prior to that, we have all these like you say, they have very little side effects or downside to them. In fact, there's an orthopedic surgeon that we have a quote on our wall that's on ESPN, and that's exactly what he says about it. It has huge upsides, decompression therapy, with no downsides. There's little to no side effects. And so to risk that, this country does 5 times the number of back surgeries than any other industrialized nation. So when you look at that, to not entertain the idea of some non-surgical spinal decompression prior to moving on to surgery, I think that's a good option for a patient.
That's really good to know, Dr. Glenn, and you're so right on that. It seems like an absolute no-brainer. Can you tell us what the process is or how that treatment is performed?
Yeah, it's quite a nice treatment, especially when somebody's in a lot of pain, acute pain, or even chronic pain. It's a very pleasant treatment. They lay on their back, the table will open up and decompress their disc, and oftentimes people will take a nap because finally their pain's abated. And it's a very gentle treatment. I mean, just think you have a big, swollen, torn up disc. You don't want some kind of aggressive therapy in there. You want something that's gentle, nourishing, encouraging that disc back to health. And that's what non-surgical spinal decompression does. And that's the beauty of it. It's such a pleasant treatment. You just lay there and the machine does all the work. The other thing I'd like to add with that is a lot of the research on decompression therapy is based off of just decompression therapy. In our program, we add other modalities in that help complement the decompression. We add in some light spinal manipulative therapies, very gentle and comfortable for the patient. We add in rehabilitative exercises, and we add in cold laser therapy. And cold laser therapy increases the oxygen carrying capacity of the blood while calming nerve fibers. It's really cutting edge, great technology.
You definitely have a state-of-the-art practice, Dr. Glenn. You've got all the latest technologies that can help with treating spinal disc herniation, not only complement the procedure as well, like you said, the different modalities that you offer. What else do you offer here at the practice that can help patients?
Well, we treat a whole body. So when somebody comes in here, oftentimes people aren't aware, especially in our practice, we can treat rotator cuff strains and tears, and we can treat knee injuries, we can treat ankle injuries. And we've had extensive training in extremity treatments and manipulative therapy. And oftentimes I'll get them because they've gotten better at PT, but they're not quite all the way over the hump. And what's missing is that manipulative therapy of the joint. Then the physical therapy has tremendous value and it gets them to the finish line. Now, we also have a wide variety of spinal manipulative therapies. Why? Every person doesn't respond the same to the same manipulative therapy. So you have to have a wide variety and be well versed in those. I have 27 years of experience, and over those years, I've added to my cachet of different manipulative therapies. Sometimes we'll use an instrument. Sometimes we'll lay them on the side like the TikTok videos and do the big crunch. Sometimes we'll use what's called a drop table. I'm amazed when patients come in and we'll use some technique and they'll be like, oh, I've never seen this in any other offices. So we like to fit the patient and the technique together. We don't try and do one technique on all the patients and hope they all get well. So we will find a manipulative therapy that is correct for that individual. I'm not going to take a 95-year-old osteoporotic woman and do a hard manual adjustment. And I think that's one of the greatest things that people in the public have to understand about chiropractic care. It's not all the TikTok crunch your back videos. There's a wide variety, and it's not one size fits all, at least in our clinic.
And that goes to your patient-centric approach where you understand that each patient is unique. What they're dealing with is a unique situation as well. So you don't utilize that cookie-cutter approach, just one size fits all for everybody. You take the time with each patient, Dr. Glenn, and that's what we hear from all your patients. You really show the compassion, give them the time and the attention to really understand what's going on with each patient and customize the best treatment or treatment options to make sure they get optimal results.
Yeah, that's correct. Not only the manipulative therapies, but we also do a wide array of soft tissue therapies. So one of the things I hear from patients is, oh, I didn't know chiropractors did muscle work. Well, I have extensive training in dry needling, active release therapy, a number of other soft tissue techniques. So we do address the muscle issue, but we know that the underlying cause of that muscle issue is most often a structural issue, and that's where the manipulative therapy comes in. So the marrying of the soft tissue with the manipulative therapy really gets us tremendous results.
Well, keep up the great work. That was a very informative interview. Can help so many people in the community, whether they're dealing with neuropathy, neck pain, back pain, so many different issues. You have a comprehensive practice, can really isolate and identify the problem that the individual patient is working through and put the best treatment plans together. That's why you're getting these great results and the patients love you.
Well, thank you very much for having me.